What is causing this condition of acidity amongst most people?
Because every stomach produces 1.5 liters of hydrochloric acid in a day.
The day they're more stressed, they're more acidic, they have more heartburn, more indigestion.
Having a good sleep will not only reduce the unnecessary production of extra acid, it will reduce the inflammation of the internal lining of your gut.
Are there any other ways that someone can tell whether they actually have a problem of excess stomach acid or low stomach acid?
H. pylori is diagnosed in a patient who is symptomatic. Then it's very important to take a proper course of antibiotics.
Why we bloat up and what are some of the most common mistakes that we're making and things that we can do to...
Very long-standing injury to the stomach keeps on happening. Then the stomach lining gets denuded, and in that, then there is a chance of cancer development.
Welcome to the Luke Coutinho Show, where we can learn to reimagine our lifestyle.
Dr. Amit, it's a pleasure, absolute pleasure to have you on Reimagine Your Lifestyle. We share common patients, by the way, and it's finally nice to sit here with you today and, extract all your knowledge and experience over the years when it comes to the gut, gastric health, acidity, bloating, constipation, all the issues that we mainly face on a day-to-day basis, which is also linked to more deadly diseases if not looked after at the right time. But doctor, before we start, take us through your journey. Why this particular field of medicine? Take us through your journey, through your vision, and how come you ended up in this particular field?
Well, basically I was always interested in science as a subject. And initially after I finished my inter-science, first year science, I was almost going to become, entered into IIT. I was going to become a mechatronic engineer.
Oh, wow. Okay.
Something related to robotics. And I was interested in studying machines. Mm-hmm. And I came from a family background of business and engineering. But then I was always mesmerized by machines. So while I was just thinking and going through, one of my family members had fallen sick and he was admitted with some issue of the pancreas. And early in the days of school, I started reading books related to the pancreas and just seeing what is this. And then I realized that there's nothing more complex and more interesting than the human body, which is the most complex and the best machine ever devised by humankind or known to mankind. And that's how I got into medicine.
Wow.
Now, in my medical career, let me tell you, again, I wanted to become a surgeon, but I was truly mesmerized by the digestive tract. Because I don't know, many people may not know it, but the body contains around 80 different types of organs. There are 12 organ systems by which our whole body is functioning. But out of those 12 organ systems, the most interesting is the digestive system. Because as I went deeper and deeper into it, I realized that this is something which I have to get into it, because the most common illnesses what we are seeing day to day are related to the digestive tract. Because the digestive tract itself is what we used to call that time is like a Pandora's box, like a magic box. Because the whole digestive system itself is having multiple organs like the solar system. I call them like musicians of an orchestra. There are 12 organs of the digestive system and all have to function in a proper way for music to come out. Each player has to play their instrument very well. Only then the end result is going to be music and not just noise. And that what's got me interested, to tell you the truth. And even in my medical college days, when I was just doing anatomy, I used to go in the dissection hall and study only the digestive tract. I used to keep on dissecting alone in the dissection hall in the midnight and open up and try to see the various organs and see the various anatomy of those organs.
Wow. So since and where all have you studied? Have you worked on any projects over and above your practice in this field?
Oh, yeah. I studied basically in Mumbai, and then I did my post-graduation over here. And that was a time when this field of endoscopy was coming in, and then I got attracted to, and I saw that this is something going to change everything in the future. So that's how I went to Germany, and I super specialized in the field of intervention, gastroenterology, and I started learning more about it. When I came back to India in 1991, many years back, I was practicing purely as an endoscopist. That means I used to go in with a telescope through the mouth or from the rectum and try to treat patients of digestive problems. But over the last 30 years, 3 decades, I became converted to a full-fledged gastroenterologist and started seeing clinically gastroenterology, in addition to, of course, endoscopic procedures by which we could treat illnesses of the digestion.
Wow. So what are some of the most common cases that you see on a day-to-day basis?
See, most commonly we see are common issues like acidity.
Mm-hmm.
Many people come to us with acid-related issues, or say epigastric or upper stomach discomfort, burning, tightness of the tummy, or heartburn. These are the very common things. Second, what we see commonly is gas bloat.
Mm-hmm.
Many people say, I've got a lot of bloating, a lot of burping, or sometimes, a distended tummy after eating food. Next common is of course bowel symptoms. That means some people come to us with irregular bowel movements. They are never satisfied with the type of motions they pass. Unsatisfactory stool formation. Constipation is a big issue which we are seeing in day-to-day practice. And of course, here and there, abdominal pain, because abdominal pain, is so difficult to diagnose because there are so many things in the tummy. So when a patient comes to us with abdominal pain, we have to really dissect it out and solve it like a puzzle to come to a conclusion as to what exactly must be the issue, and only then we can send the patients for certain investigations. So these are the common issues, in addition to, of course, other problems like bleeding from the rectum and say jaundice and such type of problems.
And doctor, why do you think we have this problem in our country? So it's everywhere. Acidity. What do you think is the main, from your viewpoint? What is causing this condition of acidity amongst most people?
I have a feeling is the changing lifestyle and the changing eating habits. It is all related to the food, the type of food you eat, the amount of food you eat, then the timing of the food. All that is very important. In addition to that, the way you eat food. For example, many people now in their day-to-day life, especially in the urban population, they don't have time to concentrate while eating food. So they are always eating food in a hurry without chewing it properly. And of course, a hectic lifestyle giving rise to tremendous amount of mental stress, inadequate body rest, improper sleep. So all this is leading to acidity. And of course, eating outside, eating food that is maybe contaminated, so you get some bacterial infections that can cause some diarrhea, or it can cause H. pylori type of infections leading to acidity and ulcers. So I think these are the common causes of acidity.
Thanks for sharing that, doctor. That's a very holistic approach. I wanted to take you through 2 examples. We have some patients who, on the nights that they sleep well, they say, hey, Luke, I didn't have any acidity on that particular day. The nights that they're sleep deprived, they're acidic. There could be several other reasons, but we see a direct correlation with sleep and even stress levels. The day they're more stressed, they're more acidic, they have more heartburn, more indigestion. How is this connected in the human body, based on your expertise?
There's one thing I want to say, that acid production, that is hydrochloric acid, is a normal thing in every human being. Because every stomach produces 1.5 liters of hydrochloric acid in a day for digestion. Because when we eat the food goes in the stomach, it gets mixed with the hydrochloric acid, stays in the stomach for around 3 to 4 hours. But the acid should not give trouble. But the problem is, because of irregular sleep or improper sleep, what happens is it causes a lot of body inflammation. And the lining of the stomach starts getting inflamed, and that same acid starts getting affected. It affects your stomach, which is inflamed, and then you start getting symptoms. Or the valve between the food pipe and stomach tends to open up because of improper sleep, or because of too much of mental tension. Then that acid comes in the food pipe. So the food pipe or esophagus cannot tolerate even a single drop of acid, because the food pipe contains alkaline secretions, that is saliva. So even one drop of acid comes up, you start getting heartburn. So I think it is a lifestyle. So sleep is extremely important. Having a good sleep will not only reduce the unnecessary production of extra acid, it will reduce the inflammation of the internal lining of your gut. And of course, it will make your gut function in a proper and a smooth and harmonious way. So that's why sleep is very important.
Amazing. Doctor, you spoke about, acids not meant to be in our esophagus. We have the LES, the lower esophageal sphincter. Many times that gets damaged because people have constant acid reflux. Is there a way, have you ever seen cases where the LES valve can actually get better over time? If someone changes their lifestyle, yeah, can you please take us through that? Because a lot of patients believe that, oh, it's damaged and this is something I have to live with. And then they don't make the changes that they should. So I would love for you to explain from a medical perspective, the LES valve, and maybe if it can improve on its own if people really change their lifestyles.
Once the food enters the stomach, that food cannot come up back into the esophagus because the lower esophageal sphincter, there's esophageal muscle, and outside the esophagus, we have a diaphragm, which separates the abdomen and the chest. So between the diaphragm, there is a small opening through which the food pipe is going inside. Now that is called the diaphragmatic hiatus. So what happens is in some people, an older age, if the diaphragmatic hiatus itself expands too much, then there is a very large hiatus hernia. Now that is something which cannot be rectified by simple measures. But just a loose lower esophageal sphincter can easily be rectified by rectifying the eating habits. And the most important is eating less food at one time, not filling your tummy too much, distending it so much that so that the stomach contents push up against the lower esophageal sphincter. Second is to eat slowly, by which you don't tend to swallow too much of air, because people who eat fast tend to gulp a lot of air. So the stomach contains not only the food but also all the air that you have swallowed. Third, not to lie down immediately after eating food, because that is another wrong habit which some people have. Then try to reduce foodstuffs which contain too much of fat content. So if you eat too much of fat content, the stomach motility reduces, the food remains in the stomach for too long, then it tends to come up inside the esophagus. And of course, doing a proper having an active life, you do proper exercise and especially breathing exercises, because by doing deep breathing exercises like pranayama, you are enhancing the pinchcock action of the diaphragm. So by simple changing of your eating habits, by doing proper breathing exercises, you can tighten your lower esophageal sphincter and prevent acidity.
Thank you. That's such a big message of hope to people, because a lot of people have already set their minds that I can't do it if the LES valve is weak. So thank you for that. Doctor, I love your holistic approach. You keep reminding us about sleep and exercise and all of these things. That's absolutely fantastic. The second thing I wanted to discuss with you is in our country, we've also seen a lot of people with H. pylori, low stomach acid, and then we have people who are producing it obviously in the opposite way. Symptoms are mostly the same. So people are taking antacids, lowering their stomach acid, and we are seeing their difficulty in breaking down protein. We're seeing their difficulty in digestion. So can you take us through how, besides, of course, doing an H. pylori test and determining that you have the bacteria, which is obviously low stomach acid, are there any other ways that someone can tell whether they actually have a problem of excess stomach acid or low stomach acid without, before they reach a testing period? Is there anything that we can be on the lookout for? Any symptoms that the body gives us?
See, just low stomach acid and high stomach acid is not the issue here. The issue here is whether there is any damage which has taken place in the lining of the stomach or no.
Like an ulcer or...
Yes, ulcer or atrophic gastritis. See, H. pylori is a bacteria which easily goes in through water or impure food. Very easily. Very, very commonly seen in our country. But even though H. pylori is considered as a precursor for gastric cancer, in India, the incidence of gastric cancer is not high, in spite of H. pylori being extreme. See, the reason is that this H. pylori is a little bit different, and probably it is not causing that type of damage in the stomach lining, which leads to ultimately to cancer. So atrophic gastritis can lead to cancer. So if a very long-standing injury to the stomach keeps on happening, then the stomach lining gets denuded, and in that, then there is a chance of cancer developing. But that we don't see very commonly in our country, which is seen in the Western population.
And with an H. pylori, it's an antibiotic course prescribed by a doctor, maybe 12 days, 14 days, 21 days. I would like you to emphasize the importance of taking that antibiotic course, because a lot of people choose to try to do it naturally. And we've seen cases where they don't kill the bacteria completely, and it's ongoing creating issues. So I would love for you to talk about the importance of taking prescribed medication for these particular cases, and not just depending on nature nature is great for many things, but in some cases you need the support of a medicine to actually kill the bacteria. I would love for you to talk about that, Doctor.
Yes. I think if at all H. pylori is diagnosed in a patient who is symptomatic, then it's very important to take a proper course of antibiotic, because otherwise that H. pylori will become resistant, that antibiotic will not work. If you've taken a half-hearted course or improper antibiotic, unfortunately, nowadays we are finding more and more H. pylori bacteria which are resistant to the normal antibiotics which are prescribed. So nowadays, in fact, what we do, we not only take when we do H. pylori testing, we take a biopsy, and we also see whether it is sensitive to that particular antibiotic, which we commonly prescribe. So it's a PCR testing, and accordingly we prescribe the antibiotics, and they have to be given in the right dosage for the right duration.
Okay, all right.
The problem here, I will tell you, that reinfection is very common. Why? Because we are not always very careful. We are living in an environment which is impure. Everything is impure. We don't know what we are going to eat here and there.
True.
Even some water, some salad, or even a food in the flight which you take, you can easily get reinfected with H. pylori. Another area where H. pylori can reinfect you is your teeth. So oral hygiene, many people don't look after it. They are only looking at everything else, but nobody looks after their teeth. Nobody looks after the oral hygiene. So it is my advice to many of my patients that at least once in a few months, go to your dentist and get a proper deep cleaning done of your teeth, because the tartar and the whatever around the teeth, that can continue to harbor H. pylori organisms.
Wow, that's an absolute new one for me. Thank you for sharing that. So, doctor, technically, based on anatomy and physiology, our stomach acid is protective for us. It's meant to kill pathogens, germs, viruses. So, in an extremely healthy individual, we could be having an H. pylori, but our stomach acid is able to kill it. So, that's what would happen in a normal, healthy body, basically.
Yes.
Okay. Doctor, the misuse of antacids in our country, because it's OTC. You know, we have people, oh, I'm going to have a biryani, so I took an antacid before. Oh, I still got acidic, so I took one after. And people are popping this for that immediate relief rather than following the prescription of a doctor, right time, right dosage. Nexium 20 is not working, they immediately go to a 40 without keeping the doctor in the loop. I would love for you to talk about the dangers of, self-medicating with antacids, even though, because the argument is, oh, but it's not a medicine because I didn't need a prescription. So I would love for you to throw some awareness on the misuse and the dangers of antacids.
See, it's a double-edged sword. People misuse antacids because it works like magic.
Yeah.
It really works like magic. And especially those people who have got burning in the tummy or a little bit of heartburn, you just pop in one antacid, and within half an hour, you will find your symptoms have totally disappeared. But the issue is that you're likely to get addicted to that. Instead of changing your lifestyle, instead of changing your food eating habits, you get addicted to taking antacids and still indulging in the type of food. So I think this is something which we need to teach the people. Because if you keep on popping antacids, you're all the time keeping on suppressing the acid. Now that will cause multiple other issues. It will cause depletion in your calcium, osteoporosis. It can lead to some cancers. Rarely it is also known to increase your incidence of heart diseases, kidney diseases. So unnecessary anti-acid intake should be avoided as much as possible.
Right.
If at all, you can take a locally acting medication of antacid, like for simple sodium bicarbonate, that you can take, or you can take a local gel, which will temporarily neutralize the acid rather than suppressing your acid.
Right.
So this is what my suggestion.
Yeah, that's great. I like that you speak about sodium bicarbonate, because not many people know that you can neutralize your acid beautifully.
Beautifully, so you can neutralize it. Even if you have symptoms, just drink some solution of sodium bicarb, alkaline solution, it will immediately settle down.
Right. So is this the same concept of enosols and all of that? So that's a better bet then. Okay. Doctor, when we go deeper into the gut, we were having a coffee and speaking about, the gut, and your face lit up when you were speaking about that. We also touched upon the topic of probiotics. Yeah. I would love for you to talk about its place in medical science, nutritional science, and also, it's easily available today. Again, like you said, I see a lot of people using it as a placebo. I ate a heavy meal, but I took a probiotic. And I would love for you to explain from a medical aspect.
See, the probiotics are basically good bacteria. Now we have to understand that the gut contains 38 trillion bacteria, which are actually more than the number of cells of the entire human body. So the human body contains 30 trillion cells and we have 38 trillion bacteria. In fact, if you were to see the human genome, the entire genetic structure of the body is also dwarfed by the gut microbiome. So the entire genetic structure of the bacteria are more than the entire human genome. So these gut bacteria are so many. There are 7,000 different species of normal gut bacteria in every person's gut. Now, how much can a probiotic supplement? Probiotic is in a form of a capsule. There are so many different species. Now, what species can one company or one probiotic capsule or a sachet provide you? However, if a person needs to take some antibiotic for any reason, I feel it is a good bet that along with the antibiotic, you should take some normal probiotics like lactobacilli or bifidobacter, so that at least you are preventing the negative effects of that antibiotic on your gut bacteria, which are getting killed. But otherwise, on a routine basis, you just keep on popping probiotics has no benefit. According to you, should do it by natural means, by taking fresh fruits and fresh vegetables. They contain more natural probiotics.
And you had mentioned homemade curd.
Homemade curd is the fantastic part.
That's amazing. Doctor, so when I want to come back to constipation, because this is like a huge issue in our country, and we see a lot of people are living with chronic constipation, thinking, oh, I'm just constipated, without understanding what it builds up into later. So there's constipation, there are laxatives, and then there's something called chronic constipation, where no matter what people do naturally, nothing works. They have to be on, laxatives. So what's exactly happening in the body for it to become chronically constipated, where even fiber, insoluble, soluble, or changes in lifestyle don't work anymore? I just want to understand how that kind of works, and they need laxatives all the time.
Constipation is a very unique phenomenon. Constipation doesn't happen just because your food intake is improper. There are four things which are necessary to prevent constipation. Your food has to be proper, containing proper fiber. Number 2, the lining has to be proper of the gut so that it gets properly absorbed, nutrients. Next thing, the stool formation has to become proper. So you have to drink sufficient amount of water so that the sufficient consistency of stool is forming. And number 4, the gut motility has to be proper. So that once the stool forms, it has to come out with one single stroke. Now, any of these 4 things, if your digestion is not proper, if your food intake is not proper, containing sufficient fiber, or if your gut motility is not proper, constipation can happen. Now, whenever a person comes to me with constipation, they have different ways of describing it. Someone will say that I've got a very hard motion. It's not just very hard. Somebody will say that motion is soft, but it's not feeling satisfied. I don't clear properly. Someone has to go multiple number of times without proper evacuation, or some just doesn't get the urge to pass a motion. So therefore, depending upon the type of constipation, we have to decide what treatment to give. For example, if you notice that it's just a firm, too hard, then we give what is called as stool softeners. Even give them the food, the diet in such a way that they causes stool softening. If the motility is not good, then we give them stimulant laxatives. Something like that. So if the digestion is not good, we give them digestive enzymes for better digestion.
Okay. For the motility of the gut, that means there is some damage internally, or is it again a lack of, the lazy bowel syndrome? They pass a little, but they don't feel like they're sitting on a pot, nothing's coming out. So then 1 hour later, and they're very uncomfortable till 11, 12 in the afternoon. So that would be more on motility?
Yeah, partly motility, partly the way of sitting also. See, because ideally, the squatting position is the ideal Indian method of squatting is the best way to relieve constipation. Because that way your rectum becomes straight. Use this English style of commode, your rectum is not straight. So many people will have constipation if you have that. So it's a good simple thing is to put a stool below your legs, so that your legs are a little bit inclined, and give a little bit pressure on your anterior abdominal wall. Many people have got a pot belly, they don't have very proper muscles. That itself can lead to constipation.
So there comes the importance of exercise.
Exercise is very, very important.
And Doctor, I wanted to, one more point on the constipation. Yeah. So we ask our patients to do this malasana position, which is the deep squat before sitting on the pot. And it's unbelievable how it just changes the way the stool actually comes out. So physical is so important. Movement is also important, I'm assuming, for our bowel movement and everything else.
And understanding that while passing a motion, you have to pull your tummy inside, at the same time relax your anal sphincter. Many people do exactly the opposite.
They tighten the anal sphincter.
And they tighten the anal sphincter, and they are not pulling your tummy inside. And they're just keeping on pushing. Nothing's going to happen. So this simple thing has to be informed. And with that, it will start happening. Of course, diet is very important for that.
Doctor, in circadian medicine now, which is kind of aligning timings, like you said, right food, right time, all of that. We know India is a country where a lot of people unfortunately eat late night meals. And they go straight to sleep without keeping, and you have the common symptoms in the morning, whether it's constipation, indigestion. Looking at circadian medicine today, we see that even the way that, like, if you're jet lagged, your stool changes. Like every time I land in New York, okay, I can't pass a stool according to India time because my entire jet lag. So there's a direct connection of our circadian rhythm with passing our stools. If you're living in our country, anatomically, physiologically, and how the human body works, is it natural for us to pass a motion when we wake up in the morning? Because there's a growing trend of children and adults who pass their first motion maybe in the afternoon when they come back from school or in the evening. I would love for you to explain this because we don't want to stress people out with what's right, what's wrong, but what is the right way according to nature that we should? I'm assuming according to my knowledge of anatomy and simple common sense, the body has collected waste. When we wake up, we get the urge to pass it out. I would love your expert opinion.
I think that is the right rhythm.
Okay.
The right rhythm is once you wake up, whatever you've eaten throughout the day or the previous day, you have to evacuate because that is the waste matter which has to go out, and then you start your whole cycle again. That is the ideal way. But I'll tell you the problem. The problem is right from childhood, training the kid. Training the kid that at a particular time of the day, in the morning, they have to sit and their bowel has to get evacuated. The commonest reason for constipation in children and as they go into adolescent age is habitual constipation because of wrong habit. So the parents have to remember that the children have to be taught right from childhood to fall into that circadian rhythm.
So like brushing your teeth.
Exactly.
Like brushing your teeth.
Exactly. Yeah. And then automatically the cycle will start.
Wow, that's a great point. Yeah. That's a great point. Doctor, a bloat, gas bloat. Common, very common. Sometimes it could be because of overeating, sometimes wrong time, wrong food, too much of caffeine. Can you tell us what exactly happens in the body, why we bloat up, and what are some of the most common mistakes that we're making and things that we can do to kind of reduce the bloat or prevent it?
Yeah. One of the commonest reasons for gas bloat is eating too fast. In fact, that is the most common reason. And because many people who come to me which say that I'm having continuous bloat, but they finish their food very fast. One simple trick I tell everyone, how to reduce the speed of eating, because they ask me, so how do I reduce my speed to eat? The simple thing I tell them is, don't take the second portion in your hand until the first one in your mouth is over.
Beautiful.
Because what we do is, before the first one is over, as you are chewing it, your second is in the hand, waiting to go in your mouth. So just keep your hand empty without the next one in your hand. Chew it well and then take the second one. So this is the first thing. Second is keeping a timing. I mean, you have to keep on eating at regular intervals. It's completely against intermittent fasting. But if you eat small meals at regular intervals, that reduces the gas bloat. One thing we have to remember, that the intestine is not a gas producing factory. Only if there are very abnormal organisms, pathogens, then sometimes it can cause too much of gas formation. But otherwise, the commonest reason is these, wrong eating habits or eating too fast. That is the commonest reason of gas bloat. Of course, certain foodstuffs can cause some gas formation, like too much of garlic, too much of onion, too much of cruciferous vegetables. They can cause gas formation.
I love what you said about intermittent fasting, because people have actually made it a fad.
Yeah.
Initially, intermittent fasting was supposed to be cyclic, according to you start fasting at the same time, but today people are doing it different timings. If I came home later, I'll do my fast later. So they're changing the cycle of fasting, which means they're actually having irregular eating patterns. But usually the original fasting was according to a certain time, like sunrise to sunset.
Correct.
So, I'm sorry, sunset to sunrise. So you had one rhythm of 12 hours, one rhythm of feeding window and fasting window. But today people choose to do it based on their lifestyle, which is not actually fasting. It's more of confusing the body with irregular timings. Thank you for talking about that point. Doctor, I just wanted to go in a little more back into the gut when it comes to stools. The longer you keep a stool in your system, okay, what's happening in the body? Like, let's say I'm supposed to pass my stool in the morning, but I just want to understand what's happening because it's waste. There's a reason it's supposed to come out.
Yeah.
What's happening in the body? It's just out of curiosity, I wanted to ask you this question. What's happening the longer I keep it into my system?
I think it is an important medium for growth of unwanted bacteria. See, because ultimately the bacteria predominantly are in the colon. Now that waste matter has to go out. So that is necessary. And secondly, if the stool matter remains in the colon for too long, then the colon slowly stops becoming active. And that constipation will keep on getting aggravated more and more. And that is the reason why that circadian rhythm is very, very important. Every day you have to get into the habit of clearing your waste matter. Because if you keep it too much inside the body, then the toxins in the body are likely to circulate more.
Got it. Thank you. Are there any long-term side effects of laxatives for patients who need to take it because they're chronically constipated? Are there any long-term side effects of it, doctor?
Depends upon which type of laxatives. If you take stimulant laxatives, like some people take castor oil, or very, very strong, some Ayurvedic powders, it's like whipping a horse. So if you keep on whipping the horse, then your horse is not going to respond until you whip it. So then what happens is the colon stops working completely. So that is a very important long-term side effect. It doesn't lead to any major side effects, no sinister problems. But this is the main problem or sometimes it can lead to vitamin deficiencies. If you are taking any laxatives which contain any oils, then that can lead to vitamin deficiencies.
And if you're doing your fiber laxatives like your psyllium husks or your metasules and stuff.
Psyllium husk has got no side effect at all because it's just like eating a vegetable. It only gives bulk to the stool. That's all.
Okay. Stool softeners?
In fact, psyllium husk or isabgol, what we call, I don't even call it a laxative. I call it a stool normalizer.
Okay.
People who have got increased number of stools, you take isabgol. Those who have constipation, also you take isabgol because it normalizes your motion.
Okay. And stool softeners, people who take stool softeners for a long time?
So stool softeners can sometimes lead to these, as I told you, vitamin deficiencies, especially if it contains some liquid, like a liquid paraffin.
Okay. Doctor, before we reach the end of this unbelievable masterclass, I want to talk about parasites and stool tests. You know, there's a lot of science today, emerging science, connecting parasites with many, many conditions and diseases and growth problems. And so one way is, of course, stool tests, although sometimes, you know, stool tests have to be done a couple of times to figure out what parasites are. You know, what would your general advice be? Because, you know, people are playing out more. People are traveling to different countries, exposing themselves in different geographies and, you know, more susceptible to parasites. I would love for you to talk about parasites and its effect on the gut. And how can we look at this more holistically? While there is, of course, different medications for that, is a stool test the best way to figure out, you know, parasites? And how would you look at this from a medical and a holistic perspective?
See, presently stool test is the only way we can pick up whether there are parasites. And in India, of course, we don't see any two abnormal different types of parasites except for a few which are quite commonly seen. But that too, only if you're tending to eat a lot of uncooked food, especially on the streets or uncooked food on a regular basis, then parasitic infections are known. Or of course, you eat non-vegetarian items which are also just smoked or not fully cooked. They can also contain some parasites. Now, if that parasite is only causing symptoms related to the gut, fine. But sometimes these parasites can cause systemic problems. They can also sometimes reach the brain and can create tremendous amount of trouble. Then it becomes a big difficult task for the doctors to treat it. But otherwise, parasitic infections are very easily treatable nowadays with medicines which we have. and almost all the parasites get killed
with that.
with that. Yeah,
Yeah. So those are like your ivermectins
exactly.
and,
Yeah,
and stuff.
yeah. Double dose ivermectin.
Double dose ivermectin. Doctor, I wanted to ask you about. We all grew up with our parents deworming us.
Yeah.
Every 6 months, one year. Is this still a great practice?
It's a good idea.
It's a good idea.
It's a good idea in today's scenario.
Yeah.
That once in 6 months you can take, because it's a single dose.
Single dose.
Just one day or maximum two nights, you just take the antiparasitic.
Yeah. So that's a good preventive.
You get completely cleared. Yeah.
Yeah. And since you brought up castor oil, that's also something which has emerged in our country. Parents would give it to us once a month, sometimes once a week, a tablespoon of castor oil. Do you still support these kind of remedies? I know there's a misuse of it also. People are constipated and they have it all the time, which you have clearly explained as a stimulant is not the best for us. But what's your take on all of these things? Have you ever explored it further?
Yeah. I will not advocate castor oil.
Yeah.
But definitely, we do a procedure called colonoscopy in gastroenterology, where we give that person a cleaning solution. It's like a irrigation.
Okay.
It's a very simple, doesn't have any side effects. It's a solution of polyethylene glycol. We make them drink a couple of liters of water in which you mix that powder. So what that powder does, it prevents the water from getting absorbed. So whatever you're drinking, that same water comes out and it completely cleans your gut. Okay. So my suggestion is, as a routine basis, maybe after every 3 months or 4 months, you take that prep, clean up your gut. Much better than probably doing a colon irrigation or something like that.
Wow.
Okay. So that is my suggestion for you. Give you a complete feeling of satisfaction of cleaning your gut, and a very, very safe and a scientific method. Similarly, I'll just come to that intermittent fasting thing. That intermittent fasting on a regular basis is not good, but once in a week, doing a fasting and giving rest to your gut, and allowing your insulin to be properly get adjusted in your pancreas and all your organs to get properly adjusted is a good idea.
Yeah. I'm very supportive in what you say about that, because if you look at every religion, every spiritual scripture, we were not fasting every day. We were fasting at particular points, every 1 week, 2 weeks. The issue today is because we're eating snack, meal. But if we're actually having just our proper meals, we have a sufficient amount of fasting between each meal. I'm very supportive in what you said. Doctor, going back to that solution, it's recommended to do it under a doctor's supervision. What you said?
No, that is not a...
How would we do it? Like if I want to do it...
Nothing is getting absorbed in the body.
So what would I do if I want to make this solution tomorrow?
You have to just go and buy it from the chemist. It's easy. That's a solution which is... You don't require a medical prescription for that.
What is it called, the solution?
It is polyethylene glycol.
Okay.
Polyethylene glycol.
All right.
And there are various companies which make it.
Okay.
And you can just take that one packet, dissolve in 2 liters of water. You can add a little lime to it. Make it cold in the refrigerator and drink it slowly.
Wow.
Over 2 hours you drink it, you slowly start cleaning your bowel and completely wash out.
So probably do this on a day that you're home.
Oh yeah, you can do it on a Sunday morning.
Thank you for that.
You feel so nice about it.
Thank you. So since you spoke about that, I want to talk about the overuse or the misuse of, a lot of centers do this colon irrigation, and they come back with severe gut issues that last for I don't know how long. What is your take on that? I mean, are these things really, really necessary, where you put yourselves on these machines and you get your entire colon cleaned out with these solutions and stuff? I want your perspective on that, doctor.
See, actually, that is a placebo effect. Because when they pass some solution inside and they clean your colon, it's only a colon irrigation, not your gut irrigation. The person feels better, feels a little good immediately after the colon irrigation. But invariably, we have found that in some places where this is done, hygienic practices are not properly followed. So many of patients who have gone to these centers and they come back with gastrointestinal infections. And then we have to treat them with antibiotics.
Right. On this topic, enemas.
Yeah.
There's a massive misuse of enemas for this whole weight loss thing, or I ate too much. And can you please talk about the dangers of misusing enemas? It's huge in our city and Delhi. Most of our clients who want to lose weight quickly or had a heavy night out, they've resorted to enema because there's a lot of promotion of even your skin clears up and some stuff. Please talk about the dangers of that, doctor.
Enema can never ever make you reduce weight.
Thank you.
Because at the most, enema can allow you to clean your bowel a little bit, but there's no way it can affect your weight. The weight is entirely dependent upon the food that you eat and the amount of exercise you do. That's all.
Okay. And if you do it too many times, the enema?
Enema can unnecessarily create damage in your
Yeah,
rectum.
your rectum. Doctor, this has been fantastic. You're so generous with your information and your suggestions for everyone. I do hope you find a time to be with us, on another podcast where we go into different details. But before we end this today, what advice would you have? We have people from around the world who will be watching this, teenagers, mums, dads, people who enter the fitness world. What advice with your knowledge, experience, and as a human being would you want to leave us with?
Well, I just want to say one thing that if you want to keep your body healthy, you have to keep your gut healthy. Because almost all the diseases of the body, they start from the gut.
Yeah.
And there are a few simple tips I will tell to whoever is watching. That number one is eat less. Don't eat until you feel full. So eat always 3/4 of your capacity. Second is don't remain starving for too long. That means in India we do something called as abhishek. You keep on doing the abhishek of food so that your gastric acid is all the time neutralized, and your stomach and your body functions are working well. Number 3, keep an active lifestyle. Don't be sedentary. Number 4, make sure that you sleep well, because if you sleep well, then your gut bacterial flora are good. And very, very important, concentrate on eating fresh fruits and fresh vegetables. And as far as possible, try to avoid gluten, try to avoid direct milk.
Yeah.
Because I don't think milk is even advocated for a normal human adult. Milk is good for children who don't eat food. Otherwise, we should eat everything which is not milk based.
Yeah.
So milk is not required.
Doctor, thank you so much. This has been an absolute,
Thank you so much.
absolute pleasure. Thank you, Doctor.
Thank you.